Hey guys, today's case is a 15-year-old African American girl which presents to the ER with continuous. Hi guys, today's case is a 15-year-old African American girl which presents to the ER with complaints of bilateral thigh and hip pain. Acetaminophen and ibuprofen have not relieved her symptoms. No recent trauma. Excess urination with burning urination. No one in her family have similar episodes. Conjunctiva and mucosal membrane are pale. WBC count is elevated and hemoglobin decreased to 7.1 grams per deciliter. Urine analysis demonstrated an abnormal amount of bacteria. So the keywords in this case is an African American girl then presents to the ER with complaints of bilateral thigh and hip pain. Acetaminophen and ibuprofen have not relieved her symptoms. No recent trauma. Excess urination with burning urination. No one in her family have similar episodes. Conjunctiva and mucosal membrane are pale. WBC count are elevated and hemoglobin is decreased to 7.1. And urine analysis also demonstrated an abnormal amount of bacteria. Sickle cell anemia is most common in African American people. Sickle cell anemia causes infarction of muscle tissues, bones and various ligaments, which explains the bilateral thigh and hip pain, which is not gone by painkillers like acetaminophen and ibuprofen. Sickle cell anemia also induces various infections and exposes the body to various infections, which usually presents as pneumonia or burning sensation while urination. In this case, there is burning urination and no one in her family have similar episodes, hence it explains that she is homozygous to the sickle cell anemia trait and the family is heterozygous. Sickle cell anemia induces damage to the RBC membrane and there will be increased destruction of RBC in the spleen and the reticuloendothelial cell system, which decreases the hemoglobin content in the body, which explains the conjunctiva and mucosal membrane being pale. As the body is induced to too many infections, the WBC count is also elevated as a compensatory mechanism to the increased infections. The infections are explained by the high amount of bacteria in the urine. These two diagrams show the two types of RBCs. This is a normal RBC and this is a sickle cell RBC. This normal RBC can easily squeeze through spleen and all the reticuloendothelial cell systems and not get damaged. But this sickle cell RBC, the RBC membrane is so fragile that it gets destroyed while it passes through the spleen and reticuloendothelial system. So the reason for this is at the 6th position of the beta globin chain of hemoglobin, glutamine amino acid is replaced by valine. This is the classic example of point mutation. So the advantages of having sickle cell anemia is immunity from falciparum malariae. So a patient suffering from sickle cell anemia won't be exposed or won't be affected ever in his life by malaria. While there is no permanent treatment for this, you can treat the symptoms, that is pneumonia or the burning urination caused by the repeated infections, or you can expose the patient to frequent blood transfusions to help for the low hemoglobin levels and reduce the pallor. So the summary for this would be sickle cell anemia, abnormal cell shape of the RBC, there will be lysis of RBC in the reticuloendothelial cells and spleen, repeated infections in the form of pneumonia or burning urination, which in that case showed bacteria in the urine analysis. Glutamate is converted into valine by point mutation. It is seen commonly in African American population. It provides immunity for malaria, and to treat it you have to treat the infections and give blood transfusions to aid for the low iron content in the body. Thank you for watching this video and hope you learned something from it. So meet you in the next one.